How do you evaluate a runner? What if someone comes in to see you and they're about to run a half marathon, let's say, not about to, let's say in a few months, and they have knee pain, hip pain, or foot pain? It's obviously you watch them run, right? You even just watch them run at some point. And the thing is with runners or with anybody who plays a sport, and really it's very meaningful for them. They need to return ASAP. You need to look at something that mimics their sport. So in this case, running. What I do when I see a runner is I'll look at a lunge. Sometimes it's hard to assess a lunge, but I do look at that. Sometimes I'll take videos and mark the videos up later, or I'll take pictures. I'll watch them lunge, and I generally have them do both, right leg forward, left leg forward, and I'll have them pick a side which feels off or which feels different. It's not necessarily where the pain is. It's just something that, it's not based on my objective. I'll have them choose a side, and then I'll assess. Then I'll assess it that way. I think that you could also, for efficiency, that's the best way to do it. If you have time and you don't feel comfortable assessing a runner, assessing them in a lunge, I would, obviously do trunk rotation, seated trunk rotation. That's really important for runners. I would also probably have them do, a teeny single leg squat. That is also quite relevant for runners, and just having them just walk, just do a step forward. But that's not so efficient sometimes, especially when you're busy in the office. So I would certainly look at a lunge, and it really replicates the running pattern, and it's meaningful for runners, especially with the foot. When you're doing seated trunk rotation, you're not looking at the foot, right? When you're doing a one-legged stance, you are, and a one-legged squat, you are. However, you're not getting that push off on that foot, especially that back foot, unless you do a lunge or you literally watch them run. So people who have foot issues or hip problems or knee problems with running, there's a very high chance that the foot is in play. The foot may not be the primary issue, but it is definitely in play and should be high on your priority list to assess. So if you're doing a single leg stance or a single leg squat, you're really not going to see the ability to become like a rigid lever in a squat or a single leg stance. You can have them do a heel raise for sure. That will also help. But I like to incorporate all the planes of movement with rotation in the lunge. Once again, it's not easy to assess, so you certainly could do all those components. But for efficiency's sake, I would certainly look at the lunge, forward or backward. I would definitely have them pick a side. In my experience with runners, the foot is very high on the list, as I said before, very high. So it behooves you also to get very skilled at assessing the foot in all planes of movement, not just, plantar flexion, dorsiflexion. It's really important to assess inversion and eversion in different positions, and I can talk about that in another video. So the reason I'm doing this is because I did have a runner recently who was doing these virtual half marathons and had a significant issue, and I assessed her virtually, actually. And I had her do a lunge in her living room, and I had her do a bunch of things because I couldn't literally get my hands on her, which is fine because I was marking up screenshots on my Apple, and I saw a lot of things with the lunge that I probably wouldn't have picked up if I sat there with my hands on her. So I think it's great for us to get a global view and just assess and sit back and see how they move. We're movement specialists, and with this particular patient, she had a right calf issue, but she didn't have the push off on her left foot, and she had poor rotation. So it was really throwing her center of mass off to the right, which is where her symptoms were. So if you don't feel comfortable doing that, just have her do a lunge, take a video, take a picture, and then put it away and look at it later. That's what I do at times. Hope it helps. Thanks, guys.